We're now back with you.
Okay.
Everybody, my topic is about the applied anatomy of brachial plexus. This is the extensive picture of the brachial plexus, which shows the origin, whereas the course in the neck goes underneath the clavicle, enters into the axilla, and forms branches. And this is the picture showing the anatomy. It's formed by 5 roots from C5 to T1. The C5 and C6 join to form upper trunk, C7 forms the middle trunk, C8 and T1 forms the lower trunk, and all the trunks divides into 3 anterior and posterior divisions. They rearrange to form the cords: lateral cord, medial cord, and posterior cord. This is the dissected specimen showing C5, C6 forming the upper trunk, C7 forming the middle trunk, and C8 and T1 forming the lower trunk. The important relationship, you can see the trunks of brachial plexus are emerging between the scalenus anterior and scalenus medius. The most important structures are the subclavian artery, which is marked in red, and the vertebral artery, and you can see the dome of pleura almost very close to the brachial plexus. And going to the approaches of the brachial plexus, there are 6 approaches, mostly interscalene, parascalene, subclavian perivascular, supraclavicular, infraclavicular, and axillary. And blocking the level of roots of the brachial plexus is called interscalene block, whereas you block at the level of trunks of the brachial plexus, it's called subclavian perivascular block. At the blocking at the level of trunks and divisions is called supraclavicular block, and block at the level of cords is called infraclavicular block, and blocking the terminal branches, it is called as axillary block. And first you know about the interscalene approach. The structures which are blocked by interscalene approach are the shoulder, the arm, lateral aspect of the arm, lateral aspect of forearm, and the hand. Whereas you can see the one which is in light blue, which is 50% blocked, whereas this one in dark blue, that is 90% of cases it's been blocked. The position of the patient lies supine with a 1.5 inch pillow underneath the head, neck, as well as the shoulder. We ask the patient to slightly turn the neck to the opposite side, and you will be feeling, or you can ask him slightly lift the head. You will be able to feel the clavicular head of sternocleidomastoid. If you slightly go down, you can feel the scalenus anterior muscle belly. Slightly beneath it is the interscalene groove. We can trace down to the base, or you can trace down to the apex. If you draw a line perpendicular from the cricoid cartilage, it meets the apex. That's the point of entry for interscalene block. So this interscalene block, the needle, it won't go more than 2.5 centimeters. You will get the paresthesia or the twitch within 2.5 centimeters. The needle should be inserted at right angles to the skin in all the planes. And this is the cut section showing the brachial plexus being sandwiched between the scalenus anterior and scalenus medius, and this is the ultrasound picture showing the brachial plexus present between the scalenus anterior and the scalenus medius, and we can see the superficial cervical plexus present just posterior to the sternocleidomastoid. Then coming to the subclavian perivascular approach, and this is the injection of drug into the perivascular sheath, where you can get very good block around the lateral aspect of the arm and medial and lateral aspect of the forearm and hand. We can see a slight sparing in the medial aspect of the arm, which is spared due to the intercostobrachial nerve. The position is same as that of interscalene. The landmarks are, for the subclavian perivascular, it should be, you have to go to the base of the interscalene groove, where you will be able to feel the subclavian artery. There we introduce the needle, and we insert the needle caudally and slightly lateral. And this is the ultrasound anatomy showing the brachial plexus submerged between the scalenus anterior, scalenus medius, and this is the subclavian artery which is present below the brachial plexus. And this is the supraclavicular approach. The landmark is, we have to feel for the position is almost the same. The landmark is, we have to feel for the clavicular head of the sternocleidomastoid. You go just 2 centimeters lateral to it and 1 centimeter above the clavicle, that is the point of entry. And this is the cut section anatomy showing the thoracic cavity and the pleura being very close to the brachial plexus here. And this is the ultrasonic picture showing the brachial plexus and you can see the lung as well as the visceral pleura being very close. This visceral pleura can be monitored by the movement during respiration, sliding movement during respiration. In case of infraclavicular approach, the areas blocked are the lower part of the arm, forearm, and on the hand. The landmarks, the position is the same. Landmarks is we have to feel for the coracoid process of the scapula. Another point is at the level of clavicular head of sternocleidomastoid. You just draw a straight line, take a midpoint, go 3 centimeters below that midpoint. That's the point of entry for a infraclavicular block. This is the cut section picture showing the brachial plexus scattered around the axillary artery and the vein, and it is present below the pectoralis minor muscle. And this is the ultrasonic anatomy showing the brachial plexus in the form of cords, that is around the axillary artery. Medial to that is medial cord, posterior is posterior cord, and lateral is lateral cord. And you can see the pectoralis minor muscle just deep, just above it. You can see all these things are present just below the pectoralis minor muscle. For axillary block, it's safe and simple. It blocks the areas, the medial aspect of the arm, medial aspect of forearm, and medial aspect of the hand, except the radial part of the hand and forearm is spared because of radial nerve. This is a position. The position is same. The arm can be abducted until you get a very good pulsation in the axillary artery. We can flex the elbow, keep the hand over the pillow. And this is the cut section picture. I can see the brachial plexus present around the axillary artery. And this is the ultrasonic picture where you see the axillary artery and all the branches of the cords like median nerve, ulnar nerve, and radial nerve. And this is the musculocutaneous nerve, which is present between the biceps as well as coracobrachialis. And this is a short picture showing the axillary sheath that covers all the contents in the axilla. Thank you very much.